brand new episode of the INSA podcast. Here on INSA podcast, we strive to inspire everyone to choose the food that brings the good, as well as to dive into the nutrition and dietetics community to know more about it. I'm your host, Pei.
And I'm your co-host, I'm Liew.
In today's episode, we will be covering the topic of the world of digital dietetics. So with the rise of the internet, the world has marched into a brand new era of the digital revolution. And in the past 20 to 30 years, the digital revolution has changed the way we do many things. For instance, changes are seen from communication and all the way to transportation. Then, as awareness towards health grew in recent years, the spotlight has switched to the way the internet and digital tools transform traditional healthcare services. Hence, the term e-health or electronic health is not foreign to many people these days.
Yearly, the use of e-health has accelerated dramatically during the COVID-19 pandemic, and many countries have used the predictive capability of big data to keep the spread of the pandemic in check. And this is just one of the many examples of how technology can be wielded under the umbrella of e-health to help care for and save millions of people around the world.
Yeah, also in the field of dietetics, digital health technologies can support the delivery of personalized nutrition care through the standardized nutrition care process, NCP. So if you don't know what NCP means, it is actually a systemic approach for dietitians to provide high quality nutrition care using 4 steps: assessment, diagnosis, intervention, monitoring, and evaluation. So without further ado, are you interested to know how future dietitians think about the digital dietetics? Stay tuned to find out more. Right, so for our long-time listeners of the INSA podcast, you might not know who Liew is. Well, she is one of my research partners in my year 3 research project and also a friend of mine. And Liew and I both knew each other, but we never really talk in class, right?
Yes, Faye. I mean, looking back, I realized we hardly talk. And from memory, I think it was just on 1 or 2 occasions that were school related. So we were basically just acquaintances, I guess.
Yeah, but because I was the class rep, it's a must to get to know everyone. So from my first impression of you, right, you're very quiet, but you will speak up if needed. And your presentation skills, oh my God, and work ethic is what really got me actually. And here's a catch. So tell me what's yours on me.
Thank you very much. But I really like your presentation style as well. In my eyes, you have always carried yourself in a very confident and strong manner, which I've always admired. And you always have that fire in your eyes in everything you do, which is so hardly seen in people these days, I believe. But sadly, we didn't get to work together until year 3.
Oh, thank you so much. Yeah, we didn't really work together until year 3, where we did our research about e-health in dietetics field in Malaysia. And throughout our research project, right, I believe we have also studied a fair share of research papers on digital dietetics across the world. And our research topic is to find out if the Malaysian dietetics community has adopted e-health wholly and practice it. And today, we'll be mainly sharing our findings and providing an overview on digital dietetics. Well, before we begin, Liew, let's clarify, what exactly is e-health?
Yes, so basically the definition of e-health refers to the use of information and technology ICT to support or enable healthcare practices. And e-health encompasses multiple domains, which includes telehealth, telemedicine, or EMR, which stands for electronic medical records, big data, and also digital wearables.
Yeah, but we are focusing on dietetics field of e-health. And because of the advancement in technology and the openness of people's approaches to health, right, there's a booming of health modalities such as mobile apps, AI integrated personal records, and also clients are expected to receive enhanced patient care from these digital tools.
Yep, that's right. And the recent pandemic has also catalyzed this transformation further. And that's because, the rapid development of COVID-19 actually provokes a need to quickly and also creatively rethink our modes of healthcare delivery. And with the implementation of social distancing, self-isolation, or quarantine around the world, people are needed to embrace e-health resources that can connect care through the internet and also its related technologies. But Pei, can you guess what is the estimated growth of e-health industry in recent years?
Mm, I guess it's a $1 billion industry, 100 billion
Mm-hmm.
WSD.
Yeah, very close to the correct answer. It is estimated that in 2020, the e-health industry was worth 120 billion US dollars, and it is projected to reach a valuation of 480 billion US dollars by 2027, which is an average 21.4% compounded annual growth.
Wow, that's a massive growth there.
Yes,
And
indeed.
yeah, and I can see why, because people were already advocating and coming
Mhm.
up with ways to facilitate the healthcare industry through digitalization even before the pandemic.
Yes, Pei. In fact, Malaysia already had plans to adopt e-health in healthcare settings like more than 2 decades ago. And this can be traced back to 1997, where the Ministry of Health actually developed Malaysia's telemedicine blueprint. Have you heard about
Ah,
it?
yeah, actually I've heard about it. Its purpose, right, is to provide an implementation roadmap for the rollout of telemedicine across the
Mhm.
nation, and it links Malaysia into a global network of virtual health services. And along with that, uh, it is to focus on to empower individuals and families using technology to assess and integrate high quality and affordable healthcare. Yeah.
Yes. However, to achieve sustainable patient care, the use of e-health actually involve many factors. For instance, it involves both sides of the parties, like patients. They actually have to take more active role in taking ownership of their health, and also healthcare professionals have to adopt the mindset of using e-health in their daily practice.
Yeah, I agree with that, because it's important to identify the practice of e-health, especially from the perspective of healthcare professionals. And
Mhm.
because dietitians are also part of a healthcare multidisciplinary team, right? I
Mhm.
mean, we wonder if we dietitians or future dietitians are ready for the change. What is your take on that, Levin?
Well, today there is not enough survey done in Malaysia for us to actually gauge the big picture. But we do know some healthcare providers have utilized e-health solutions in practice locally. But this phenomenon is more commonly seen in private practice or private healthcare settings, actually.
Yeah, from what I see now in the market, there's a lot of digital healthcare startups in Malaysia that have already been established, like Naluri and LiveSmart.
Mm.
However, there's some ambiguity in there, because in of course in e-health readiness and also the use of e-health in dietetics practice.
Yes, true. I mean, from our findings and also literature reviews, there are a few factors that have contributed to this so-called ambivalence, like age, working experience, and practice settings dietitians are in. So some studies, they concluded that younger dietitians generally uphold a more positive attitude towards the utilization of e-health in patient care. But however, some say like age is not significant in this case at all, but also working experiences and designation demonstrated a correlation with e-health readiness as well. For instance, managers or senior dietitians, they may be better informed and involved in its institution's e-health policies and also its strategic plannings, meaning they are key people to decide whether to utilize e-health in practice settings or not.
Yeah, also with regards to practice settings, right, you mentioned, we
Mhm.
found that the use of e-health tools is actually more advanced in private settings than in government. And in terms of area of practice, it is believed that dietitians have a positive attitude on the implementation of e-health practicing for the inpatient rather than the outpatient. So to summarize everything, all the studies done have suggested that more surveys need to be done.
Yes, so in our research, we have come up with our own set of questionnaires to be sent out across dietetics professionals who provide patient care. Hopefully, we could address some of the research gaps here.
Yeah, we have also done face validity, which is a kind of validation method. So if you are a practicing dietitian listening to our podcast, you are most welcome to participate in our research.
Yes, and the link is provided in the description box below. So do check it out if you're interested in gaining a better appreciation of how e-health can be used to improve nutrition care for your patients.
Yeah, even though there's a rise in e-health, right? Many promises of e-health R&D, research and development, have not been fulfilled yet. There are many challenges raised by researchers about e-health, such as lack of commitment by healthcare providers, lack of interoperability across different health information systems, and all these rights calls for need to review these challenges. So in the end of our research, we would be able to use the result from this study to suggest ways for dietitians or authorities to plan out strategies for the successful adoption of e-health into NCP and address potential barriers to implement it.
Yes, Peggy. Just curious to know, what have you learned throughout these few months of research? Perhaps you can share to our audiences.
Oh my God. Wow, you sound like our supervisor, Dr. Lee.
Yeah,
Oh my goodness.
I hope she's listening.
Okay, throughout the process, I've learned that whatever we read, going through so many literature reviews to better understand our research topic, there's always room for discussion on how we perceive the information and also translate it into our own thoughts and writings. So basically, it's very important to have that critical thinking skills. Yeah.
Yes.
And other than that, right, this research has also given me insights into how dietitians can actually play a role in delivering healthcare through e-health. And I truly believe that the future of e-health should be embraced by dietitians in the workforce by keeping up with technological advances, as this can support dietetics standards to enhance patient care. What about you, Liew?
Yes, I mean, I agree with you, like totally. And this research has indeed helped me to gain a better understanding of how e-health can support us, dietitians or future dietitians, in delivering quality patient care. Another valuable lesson I've learned throughout the entire research project is the term teamwork. So oftentimes people think research is a very difficult task, but really, with the help of your research partners and supervisors, it will surely remove the load from your shoulders. So just like the quote from the famous Helen Keller, alone we can do so little, and together we can do so much.
Wow, I like that quote over there. Yeah, hopefully through the cross-sectional study on e-health use and practice of dietitians in the Malaysian private and government sector that we will provide in the link in the description box below, we'll be able to contribute the expansion of dietetics, and in many years to come, right? We may have already equipped the future dietitians like us with dietetics practice criteria for nutrition NCT selection and use. Just dream big and manifest it, guys. Right. Yeah, right. That's all for today. Thank you so much for tuning into our podcast. We hope that this episode has impacted our listeners and brought about insights into the nutrition and dietetics field. Before signing off, do check us out on our Instagram page at insa.imu and our podcast at Insa Podcast. This is the Insa Podcast, inspiring everyone to choose the food that brings the good. Goodbye.
Bye-bye.